Hey there everyone, in the previous video we had studied the muscles of the medial compartment of the thigh, the origin, insertion, nerve supply and the actions along with the surface landmarks and diagrams. So in this video we are going to study the obturator nerve definition, branches, course, origin, okay, and obturator, accessory obturator nerve, obturator artery, and at the last we are going to study the medial circumflex femoral artery that also supplies the medial compartment of thigh. Okay, so let's start with the obturator nerve. Okay, what is obturator nerve? Obturator is a nerve that supplies the medial compartment of the thigh. Okay, it is a chief nerve that supplies the medial compartment of the thigh. It is a chief nerve that supplies the medial compartment of thigh. Okay, so its origin is from the ventral divisions of the anterior primary rami of spinal nerves L2 to L4 from the ventral divisions. Okay, ventral divisions of the spinal nerves, L2 to L4 of the ventral divisions, okay, or the anterior divisions. We will see that in the diagram now. So it is originating from the L2, L3 and the L4. It is originating from the L2, L3 and the L4. From the L2, L3 and the L4. The dorsal divisions of the L2, L3 and L4 form the femoral nerve, and the ventral divisions from the L2, L3 and L4 form the obturator nerve. Okay, they form the obturator nerve. So it is written here, origin is ventral divisions of anterior primary rami of spinal nerves L2 and L4. Which divisions? The ventral divisions. The dorsal divisions give the femoral nerve and the ventral divisions they give the obturator nerve. Okay, they give the obturator nerve. It is proximal to the pelvis, and it then it goes to the thigh through the adductor canal. Okay, to the adductor canal. Now we are saying we saw the origin. Now we are saying the extent or the course. Okay, so it passes through the adductor canal and then divides into two divisions. Okay, the posterior divisions of the obturator nerve and the anterior divisions of the obturator nerve. Okay, now we are going to see the branches of it. Okay, but before that let us see the terminations. Okay, the posterior one, it gets terminated into the genular branch which supplies the knee joint. Okay, genular means joint. Okay, so the genular branch to the knee joint, and the anterior, it supplies a subsartorial plexus. It supplies the subsartorial plexus. We had already seen that in the front of the thigh. You can go check the series in my playlist. So this is the sartorius muscle. I'm going to explain it again. Okay, so this is the subsartorial fascia. In between that there is the subsartorial plexus. So the anterior divisions of the obturator nerve, they continue as the subsartorial plexus. Okay, between the sartorius muscle and the its subsartorial fascia. Okay, the anterior divisions, and the posterior division supply the knee joint. So this is the termination. Okay, now we are going to see the branches. So the anterior branch and the posterior divisions. Anterior divisions are the posterior divisions. Okay, the anterior divisions give off 5 branches and the posterior divisions give off 3 branches. Okay, anterior 5 and posterior 3. So see, the anterior supplies the hip joint, the pectineus muscle, the adductor longus muscle and the gracilis muscle. Okay, and if not supplied by the posterior, the anterior supplies the adductor brevis. I had already told that in the previous video. See, the adductor brevis lies behind the pectineus muscle and the adductor longus muscle. Okay, the adductor brevis muscle is small. Okay, it lies behind the pectineus muscle and the adductor longus muscle. See here, behind the pectineus and the adductor longus muscle. So it is at this place. So the hip joint, the pectineus muscle, the adductor longus muscle and the gracilis muscle. Okay, and if not supplied by the posterior division, the anterior division supplies the adductor brevis, and the posterior divisions are they supply the obturator externus, the adductor magnus muscle, and if not supplied by the anterior, the posterior supply the adductor brevis muscle. Okay, so these are the branches of the obturator nerve, and these are the terminations of the obturator nerve. This is the termination of the obturator nerve. See here now, The brevis lies behind, the adductor brevis lies behind the pectineus and the adductor longus that I have already told. In between this is the anterior division of the obturator nerve, as we have seen it just now, right? So this is the adductor brevis, pectineus and the adductor longus. So this is the anterior division of the obturator nerve. So this is about the branches of the obturator nerve. Now let us see that in detail again. The obturator, the anterior division of the obturator nerve continues as the subsartorial plexus, continues as the subsartorial plexus. I have explained it here, and it is it supplies the hip joint, the pectineus muscle, the adductor longus muscle, the gracilis and the adductor brevis. Only if not supplied by the posterior branches, it supplies the adductor brevis muscle, because we know that the adductor brevis is not a hybrid or a composite muscle. Okay, the hybrid and composite muscles is the pectineus and the adductor magnus. Okay, now the posterior divisions of the obturator nerve, they pierce the obturator externus muscle. Okay, they pierce the obturator externus muscle. Which muscle? Obturator externus muscle. And they supply the obturator externus as well, and they supply the adductor brevis because it is lying behind the pectineus and the adductor longus muscle, and they supply the adductor magnus muscle. Okay, so adductor brevis, they supply the adductor brevis only if it is not supplied by the anterior divisions. Okay, so the adductor brevis either by the anterior divisions or either by the posterior divisions, not by both. Okay, now we are going to see the accessory obturator nerve, or accessory obturator nerve. It is found only in 30% of the individuals or subjects. Okay, only in 30% of the people. Arises from L2 and L3 ventral division of anterior primary rami of spinal nerves, L3 and L4. See here, L2, L3, L4. On the ventral side we have the obturator nerve, L2, L3, L4, and on the posterior on the anterior side only, from the only L2 and L3 we have the accessory obturator nerve from the L2, L3, L4, accessory obturator nerve from the L3 and L4 only. Okay, so see here, it gives off 3 branches. The accessory obturator nerve, 3 branches. Okay, it supplies the hip joint, the pectineus muscle and the communicating branch of the obturator nerve. Okay, sometimes it is very small that it ends up supplying only the pectineus muscle. If it is long, if at all, first of all it is present only in 30% of individuals. If at all it is long, it supplies the 3 things, that is the hip joint, the pectineus and the communicating branch. If it is very small, then it ends up supplying only the pectineus muscle. Now we are done with the accessory obturator nerve. Now the obturator artery. So now we are going to see the obturator artery. Okay, obturator artery, it supplies the medial compartment of the thigh. So its origin is from it is a branch of the internal iliac artery. Okay, see, first the common iliac artery divides into the external iliac artery and the internal iliac artery. The external, it continues as the femoral artery, but the internal iliac artery, it gives off a branch called the obturator artery. So this is the origin of the obturator artery. And see, in the upper margin of the obturator foramen, the obturator artery divides into the medial and the lateral branch. The obturator artery gives off the medial branch and the lateral branch. So what is obturator foramen? So this is the hip bone. Okay, so this is the hip bone. See, this is the obturator foramen, marked colored with the purple color. So this is the obturator foramen. On the upper margin of this, the obturator artery passes and divides into the medial and the lateral divisions. Okay, the medial is also called as the anterior and the lateral is also called as the posterior. Okay, as I've already told in the previous video. So see, the medial or the anterior, it continues, it forms the anastomosis, okay, with the medial circumflex femoral artery. Okay, around the obturator membrane, it forms anastomosis with the medial circumflex femoral artery. These are the branches and the terminations. Okay, so we have seen the origin, now we are seeing the branches. So see, the medial branch of the obturator artery, it forms the anastomosis with the medial itself, the medial circumflex femoral artery, and the lateral, it gives off a branch called the acetabular branch. The lateral, it gives off, again it gives again a branch, that is a acetabular branch. It passes through the acetabular notch. It passes through the acetabular notch on the bone to supply the acetabular fat and divide to form the femoral artery or the foveal artery along the head of the humerus. So see, if this is the head of the humerus, no, so there is a small pit here, so this is called as the foveal. Okay, so this is the foveal artery, that foveal artery that supplies the head of the humerus. Which branch? The acetabular branch, of which the lateral branch of the obturator artery. Okay, so this is the branch, these are the branches of the obturator artery. So now we are going to see the medial circumflex femoral artery. It arises from the profunda femoris artery. From the profunda femoris artery, we get a branch of the medial circumflex femoral artery. We have already seen that in the front of the thigh chapter. You can check out the playlist. Okay, see again the common iliac artery, internal iliac artery, and the external iliac artery. So this is the femoral artery, gives off an important branch, that is the posterior, the profunda femoris artery, that supplies all the compartments of the thigh. Okay, all the compartments. So see, this is the medial circumflex femoral artery. It has two branches. This is the ascending branch and this is the transverse branch. Medial circumflex femoral artery, two branches, ascending branch and the transverse branch. The ascending branch forms the anastomosis along with the superior gluteal artery and the lateral circumflex femoral artery to form the trochanteric anastomosis. Okay, and the transverse branch and the inferior gluteal artery, same with the lateral circumflex femoris artery only, it forms the cruciate anastomosis. We will study this anastomosis in the detail because we are really good at doing the anastomosis, right? So see, the ascending branch with the superior gluteal artery, it gives trochanteric anastomosis. The transverse branch with the inferior gluteal artery gives the cruciate anastomosis. Okay, so yeah, this is it. And before giving terminal branches, okay, before it gives terminal branches, it gives off many muscular branches. Okay, and acetabular branch that supplies the acetabular notch and the acetabular fat, and the femoral artery that supplies the head of the femur, as we have already seen. Thank you so much.